Our next condition in this category of fetal head and neck anomalies is the congenital hydrocephalus. Hydrocephalus is characterized by the accumulation of cerebrospinal fluid within the ventricles of the brain. This buildup leads to an abnormal enlargement of the ventricles, which can cause increased intracranial pressure that can significantly impact the developing brain, making early diagnosis and monitoring very crucial. Advanced imaging techniques such as 3D and 4D ultrasound allow us to assess the severity of ventricular enlargement and its potential effect on other brain structures. In the next segment, we will explore how these imaging modalities are used to identify and evaluate this condition in details. Let's discuss the role of 3D and 4D ultrasound in diagnosing congenital hydrocephalus. Starting with 3D ultrasound, while it is not typically the first-line imaging technique for this condition, it provides valuable supplementary information. For instance, 3D imaging can help assess the overall shape and volume of the skull. In severe cases of hydrocephalus, for example, we may observe an enlarged head circumference, which can raise suspicion of significant ventricular enlargement. Moving to 4D ultrasound, this modality offers real-time imaging, making it particularly useful for evaluating the structural impact of hydrocephalus. It allows us to visualize the enlarged ventricles and the accumulation of cerebrospinal fluid more effectively. This dynamic imaging can enhance our ability to study the brain architecture, helping to identify secondary effects of the condition on surrounding brain structures. Together, these advanced imaging techniques complement standard diagnostic methods, giving us a more comprehensive understanding of congenital hydrocephalus and its impact. Now let's review the key findings on ultrasound that are indicative of congenital hydrocephalus. One of the primary markers is enlarged lateral ventricles. Measuring the ventricular width is crucial, and measurement exceeding 10 millimeters is a strong indicator for hydrocephalus. This finding serves as a threshold for further investigation and monitoring. In cases of progressive hydrocephalus, we may observe dilatation of the lateral ventricles, which can exert pressure on and lead to changes in the brain parenchyma. This highlights the importance of tracking the condition over time to understand its progression and potential impact on brain development. Additionally, abnormal head circumference growth is another significant finding. An accelerated increase in head size, often detected during routine biometric measurements, may suggest presence of hydrocephalus and warrants a closer look using advanced imaging techniques. Identifying these key findings early is crucial for diagnosis and to guide management decision. In the next section, we will explore the associated conditions often seen with congenital hydrocephalus. Congenital hydrocephalus can occur as an isolated condition, but it is often associated other abnormalities that can influence both diagnosis and management. Some of the more common associated conditions include aqueduct stenosis, where there is a narrowing of the cerebral aqueduct, which blocks the flow of cerebrospinal fluid and leads to ventricular enlargement. Another example is Chiari type 2 malformation, which is a structural defect in the brain where part of the cerebellum extends into the spinal canal, which can disrupt normal cerebrospinal fluid flow and contribute to hydrocephalus. Another good example is intrauterine infections during pregnancy, such as cytomegalovirus or toxoplasmosis, can damage the brain and lead to abnormal fluid accumulation. Identifying these associated conditions is essential, as they may provide insights into the underlying cause of hydrocephalus and have significant implications for prognosis and treatment. Let's now discuss the management and prognosis of congenital hydrocephalus. Early and accurate intrauterine diagnosis is critical for planning appropriate care. Advanced imaging techniques like 3D and 4D ultrasound play an essential role in identifying the condition and monitoring its progression throughout pregnancy. After birth management typically involves shunt placement to drain the excess cerebrospinal fluid. This procedure helps relieve intracranial pressure and reduces the risk of further complications. The shunt allows for long-term management of fluid accumulation, improving the child's chances of a better quality of life. Prognosis of congenital hydrocephalus vary widely and depends on several factors, including the underlying cause, of course, and the severity of the condition. Cases with minimal brain damage or isolated hydrocephalus tend to have a more favorable outcome. However, when associated with other anomalies or infections, the prognosis may be more guarded. Early intervention and a multidisciplinary care approach are essential in optimizing outcomes for the affected infants and their families. Next, let's move on to the next fetal anomaly in our lecture.